Now, let us learn uh, in the SAR of streptomycin. Already we learned that it consists of streptidine and N-methylglucosamine. N-methylglucosamine consists of two portions, that is, streptobiasamine. So, streptobiasamine consists of streptose and N-methylglucosamine. Both together, we call it as streptobiasamine. Clear? Streptidine and streptobiasamine. Entire portion, this entire bottom portion is called as streptobiasamine, which comprises of streptose and N-methylglucosamine, which are glycosidically linked together. Now, during SAR, let us learn one of the important thing, one by one of the three components. Lot of modifications are done on streptose. The streptose is the center portion, which is five-membered sugar portion. We know that sugars can be hexose form as well as five-membered form. Now, this is five-membered form, which is looking like furan, which is looking like a furan. We know that furan, tetrahydrofuran. So that's why this sugar is called as furanose. We can also call it as furanose. That is a raw type of naming. Just like whomever you see a male person, you can tell as male. So this is a furanose form. Specific name is streptose. Now, on this streptose, lot of research has been done and we got different compounds. Let us discuss about that. Now, in the streptose, what happens is that there is aldehyde portion. This is aldehyde portion. You observe we have highlighted in a red color. So now this aldehyde, you can reduce it. When you reduce an aldehyde group, you can see it. When you reduce an aldehyde group, what happens is that you get an alcohol portion. You get an alcohol portion. Aldehydes on reduction gives alcohols. You get alcohol. Reduction means additional hydrogens. So you get alcohols. These alcohols, now the drug, what we call it as? We call it as two extra hydrogens came. We call this as dihydrostreptomycin. We call it as dihydro. Why dihydrostreptomycin? Because two hydrogens came extra on reduction process. On reduction process, the aldehyde portion present in streptose has been reduced to alcohol portion. Then the entire molecule is called as dihydrostreptomycin. I'm telling what do you mean by dihydro? Because two hydrogens came. Hydrogens came, which is active similar to streptomycin. The activity is same to streptomycin, but disadvantage is that this drug produce severe deafness than streptomycin. What happened? The deafness is more. Ototoxicity we were discussing, that is the side effect is more with dihydrostreptomycin. That's why nowadays the drug is available only in streptomycin. Now, even you see oxidation of the on the same aldehyde group to oximes. I told you many times that aldehydes and ketones, when treated with hydroxylamines, we get oximes. We studied in cephalosporins, even penicillins, even what is that? Anticholinesterase reactivator, prolidoxin. The same we are discussing again. If you convert to oximes and phenyl hydrozones, that means aldehydes, ketones, when treated with hydrazine, you get hydrozones. Hydrozones, same aldehydes for example, aldehydes, when you treat with hydroxylamine, you can see it, hydroxylamine, we get hydroxylamine. That's hydroxylamine means this hydroxyl group and amine group. All are having functional group. Here also they have all functional group. Now what you get is you get like this one R C double bond N H O H O H. Like this. This is called as oximes. This is called as oximes. This is called as oximes. Which even oximes. And also when you treat with phenyl hydrogen means you know pH and NH2 NH2. This is called as phenyl hydrogen. When you treat with this, what happens? Same way you get like hydrazone, which is called as C double bond N. For example, if it is ketone, NH, NH2, NH and phenyl group. Because with the loss of water molecule, what happens is that because here one and ketone have one of the double bond oxygen. So there is hydrazone. These are hydrozones, phenyl hydrozones. This is called as oximes. Both of them resulted in inactive molecules. So this is a one more important activity. What they had done is that they made the terminal methyl group. This is the methyl group to alcohol group, CH2OH, alkanes. Even on oxidation, you get alcohols. They tried to do on that, resulting in CH2OH. Then also there was no advantage over streptomycin. So nothing can be changed on streptose. Nothing can be changed on streptose. Whatever they tried, they were getting good molecule with a dihydrostreptomycin, that is reduction with aldehyde group to alcohol group that they got. But what happens is ototoxicity was more severe than streptomycin. That's why they stopped this one. And they tried to do it on the same aldehyde portion, to convert to oximes and phenyl hydrozones. It was not able to success. Then they tried to do something on the methyl group, converting into alcohol portion. Still, it also hasn't resulted any activity. Not advantages. Now, last, let us see on N-methyl glucosamine. On N-methyl glucosamine, they tried. It's also very important for the activity. N-methyl glucosamine, the nitrogen atom should be secondary amine. It's already in secondary amine. That means if you try to remove or elongate it, what happens is that activity decreased. Modification of group by demethylation, replacement with a larger alkyl group, reduced activity. Just now we told. Then streptidine. Streptidine also. On the streptidine molecule, what happens is very important. There is no much change on the guanidino group are very, very important for the activity. Very, very important. There is no much changes. So this streptomycin drug the structures are very, very important. That is streptidine, streptose, and N-methyl glucosamine. Whatever they were trying to do, it was losing activity. It was not having any TB activity. That's why they retained as such. Now, when you when you in acidic on metabolism, what happens is that in acidic pH, streptomycin will break as two portions, that is streptidine and streptobiosamine. It breaks as streptidine and streptobiosamine. So this is the metabolism. So when it breaks the cleavage, what happens? The activity is lost. I told you one more time that these drugs doesn't get metabolized in the body. Very rarely they get metabolized. Outside, when they were learning the stability studies, they added some acid and checked. The drug was getting cleaved. So this is about SAR. Any clarification, please? Okay. Now, mechanism of action. There are some two or three mechanisms. What happens is the most important is that it causes misreading of DNA. See what happens here? AUG is a methionine codon. Methionine is a codon. Now, instead of now you can see it, they are complementary each other. Now this drug will come and alter this codon, so tRNA cannot produce the correct amino acid. Correct amino acid. That's why we are calling it as the drug which causes what we are telling, you see, misreading of mRNA codon, leading to error in amino acid sequencing, sequence. That is the most important and acceptable mechanism of action. Now, in addition, they also found that it inhibits translocation process. Just like macrolides, they also inhibit translocation of tRNA. That means changing of tRNA to another codon is also it blocks. Then it also disrupts polymerase enzyme. Polymerase enzyme is one which causes opening of double-stranded DNA. That also it inhibits. So three mechanisms they're telling, and it inhibits. And one more thing is that these drugs bind to 30S ribosome. These drugs bind to 30S ribosome. So this is also one of the important factors. Macrolides were causing binding to the 50S ribosome units. Now here, these drugs bind to 30S ribosome unit and does all these activities, that is misreading of codon and inhibition of translocation of tRNA and disruption of polymerase enzyme. So these are the mechanism of action for these aminoglycosides. Now, uses, we are almost done. Now you can see it is used in treatment of TB, leprosy, plague, UTI. Very good, UTI, because it concentrates even in respiratory tract infections. So TB is also one respiratory tract infections, and parasitic infections, especially Paromomycin. So these are some of the uses of this drug. In tuberculosis, streptomycin is one of the important component. This is a bactericidal drug. Along with INH, rifampicin, we can give this drug for 3 months. There is specific regimen you need to follow, and our TB is going to get eliminated from our body. Once it was called a deadliest disease. Now we are calling AIDS. AIDS is a deadliest disease. In those days, it is very deadliest. It's also used in leprosy. leprosy, plague, urinary tract infections, respiratory infections, and parasitic infections. Now, let us see what are the side effects. The side effects, let us discuss a little more. It causes severe ototoxicity. Severe ototoxicity. They done a lot of research in this concern area, and they found that it is able to cause cochlear damage. This ototoxicity main by binding to cochlear damage, uh, by binding to cochlear and causing its damage and causing hearing loss and tinnitus. So these are the some of the important, and the drugs which causes ototoxicity by binding to cochlear damage is kanamycin, amikacin, and neomycin. Neomycin. So these are the some of the drugs which damage. Some of them damage vestibular component which is present in ear. Now, when it damages vestibular, what happens? You get vertigo. This is nonsense disease. You can't concentrate. You can't stand properly. Ataxia, loss of balance. Loss of balance. What are the drugs which produce ototoxicity by damaging vestibular damage is streptomycin and gentamicin. Gentamicin. Tobromycin has both ototoxicity. Both. It can damage cochlear as well as vestibular present in the ear. Nitillamycin. Nitillamycin is claimed to have low ototoxicity among the group. So this is the one of the important factors. During examination, they may ask among all the aminoglycoside, which is the least ototoxicity is nitillamycin. Nitillamycin. Now, one more important side effect is nephrotoxicity. We already learned in properties why these drugs produce ototoxicity and nephrotoxicity, because drugs concentrate in this region. Nephrotoxicity means it is making sense because it is water soluble, so it dries. But we don't know what's the reason why it causes. But we learned how it causes ototoxicity, that is damaging cochlear and vestibular. Now, one more thing is nephrotoxicity. It produces nephrotoxicity. Whenever you are giving these drugs, you need to avoid this. Sorry, what is this? So you need to avoid these drugs with the help of other drugs which produce nephrotoxicity, such as furosemide. Sorry. Correct. What we are telling is correct. Sorry. So avoid. These are other drugs. Furosemide, these diuretic drugs. Ethacrinic acid, minocyclines. These drugs also produce ototoxicity. So you should, suppose if the patient is suffering from what is that, fluid accumulation, instead of furosemide, you select another drugs. Instead of ethacrinic acid, you select iron. What is that? Torocimide, like that, because these drugs also produce ototoxicity. So these are mostly about ototoxicity. Please remember that. It also produces nephrotoxicity, and it also produces neuromuscular blockade by blocking acetylcholine function at the nicotinic receptor. Muscle weakness you feel. Muscle weakness you feel. That's what we are telling. Neuromuscular junction block, like just like a detuberculin symptoms you get. Not prominent, but we have this property. The drugs which produce most of this is neomycin and streptomycin. Streptomycin. And also these drugs can interact with calcium. It also can interact with calcium and causing a complex. Now, adverse effects as usual, nausea, vomiting, anorexia, rash, and urticaria are the important other side effects. So this is about these streptomycins. Let us learn about Paromomycin. Paromomycin. This is also one of the important drug in aminoglycosides, because it is including along with antimicrobial activity, amoebiasis, giardiasis, leishmaniasis, and tapeworm infections. We studied this drug, paromomycin, as intestinal drug. The drug will not be absorbed through intestine. It stays there. You can give a suppository form. Best drug is a suppository form, or by enema. One more important is by enema. So you can inject. Sometimes we can clean our intestine, large intestine, by supplying water from the rectum. So that process is known as enema. During surgeries they do. Where you can add in those solutions this drug, paromomycin. Enema forms are also available. Then what happens is that the drug stays there and kill all this, because these are the infections of large intestine and comes out from our large intestine. That is one of the important factor. And you can also see it is the first line treatment for amoebiasis and giardiasis during pregnancy. Whenever you have pregnancy, this is the first line to treat for amoebiasis and giardiasis. Otherwise, generally it is second line treatment. So you can give by mouth, because it's not absorbed. You can give in the form of tablet or applied on the skin or injection at the muscle. It also inhibits protein synthesis in a non-resistant cell by binding to 16S ribosomal RNA. The same way, it inhibits that miscoding, misreading of codon, and also translocation process. Now, let us see. You can see some of other drugs. Now, these are the some of drugs which we have seen. Kanamycin, you see, this is streptomycin. Wherever there is a guanidino group, that is nothing but aminocyclitols. Streptidine. Remaining other drugs, you can see it in neomycin. This is the amino portion. This is so you can see it. Deoxy, one group is there is no any hydroxyl group. Here also see deoxystreptamine. Most of them, all these drugs consist of deoxystreptamine, which is aminocyclitol. You can see it here, streptobiasamine. This is also one sugar portion. Many sugar portions are present in paromycin, neomycin, kanamycin. Deoxystreptamine is present in all other drugs except streptomycin. So this is regarding streptomycin. Any doubt, please? Okay, let me ask a few of them as questions so that you captured or not. Alice.
Yes.
Alice, tell what are aminocyclitols? Now, your wish, axilla,
Aminocyclitols are these aminoglycosides, which are, instead of, they are not having this guanidino group, instead they're having amino group, and then they are also bound to sugar molecules.
you can refine, someone can tell. Kush.
The aminocyclitol ring is basically the glycon portion, which we see on top, which is the 6-membered ring, and which like in streptomycin, it's streptidine, right? So it's basically having the guanidine group that's also in form of, we can change like through the amino group in rest, and that is the glycon portion basically.
What is another aminocyclitols present in another drugs?
It is normally the deoxystreptamine.
Okay, thank you. I think another 30 minutes finished. Please join again. Last.